Hello and Assalamu alaikum. My name is Saudari and I'm a nursing student currently studying at the Khyber Medical University, BSc in 7th semester. This is a video demo lecture and the topic that which I will explain in this video is triage. So let me start with a very basic concept that actually what is triage, right? So triage is basically is the process of sorting, but like categorizing the patient on the basis of severity and their condition. So it helps healthcare workers decide who needs treatment first during the emergencies or disaster when there are many patients at the same time. The main purpose of the triage is to save many lives if possible by giving priority to critical ill patients, right? So what is START Triage, right? So START Triage stands for the simple triage and rapid treatment. It is a kind of quick method used during the mass casualty and incidents such as earthquake, bomb blast, accidents, fires, right, and natural disaster such as flood, right? So START Triage basically help rescue or assess patients less than in 1 minute and assign them a color category, right? So the main principle of the START Triage is to quickly assess, right, give a color tag and move to the next patient as soon as possible. Color category in the START Triage, basically the first thing is green. The first color is green. So green mean minor. Green take patients have a minor injuries and can walk themselves, right? These patients can wake for a very long time, so they are called the walking wound, right? So minor cut and small wounds, mild pain, they might be considered in the green category, so they are called walking wound patient, right? The next thing is the red tag, immediate, right? So red tag patients immediate treatment need immediate treatment because their condition is the life threatening. A patient become red if there is problem in the respiration, if there is problem in the perfusion, and if there is problem in the mental status. So the assessment is called the RPM assessment, respiration, perfusion, and mental status assessment. So what we really do is the first thing is to assess the respiration. The rescuer or the nurse or anyone near the patient's paramedics may quickly assess the patients for the breathing. If the patient is not breathing, the rescuers open the airway by giving them a head tilt and chin up position, right? If the breathing starts after the opening the airway, so the patient is tagged red, right? If the patient still does not breathe, so the patient is tagged black. If respiratory rate is more than 30 beats per minute, so the patient is tagged red because the fast breathing may indicate shock or severe injury, right? The second thing is perfusion. Perfusion means blood circulations to the body's tissue, right? So the rescuer may quickly assess by pinch the finger and wait for at least 10 seconds, and they may assess the time that how quickly the color change, right? So capillary refill times and radial pulses. So capillary refill times normally returns within 2 seconds, right? If capillary refill times is more than 2 seconds, so the patient is tagged red, and if radial pulse is absent, the patient is tagged red. This is immediate situation and need urgent care. The third thing is the mental status. Obviously, the rescuers or the nurse check whether the patients can follow the simple commands or not. Like if you ask the patient, right, can you open your eyes? And if he opens your eyes, yes, he following the command. And if you ask them to squeeze your hand, and he squeeze your hand, so they are actually following your command. So the patient, if the patient cannot follow simple command, the patient is tagged red because altered mental status may indicates brain injury or poor oxygen supply to the brain. Yellow tag is delayed, right? So yellow tag patients are seriously injured but stable enough to wait for a very long time, not that much, but can wait almost, like stable fractures, moderate injuries, right, and control breathing. So the next thing is the black. Black tag decreased disease for sorry black tag patients are dead, are not breathing even after the opening the airway. So in the mass casualty incident, CPR is usually not performed because the time and rescuer must focus on the patient who have a better chance of survival. So we need to prioritize the patient, right? So approach to the patient in the START triage is obviously the RPM, and if the RPM finding is abnormal, the patient is tagged red. If the RPM is normal but the patient is still need care, the patient is tagged yellow, right? If you ask someone by like what is the difference between the other hospital triage and the casualty mass such as START triage, so the difference between these is we use START triage. It is very simple, not detailed, just to quickly assess and categorize them on the basis of how severe their condition is.